Hey guys, it's Matt Sloan. I want to talk about this patient's x-ray for a minute because they have a severely arthritic right hip, as we can see here, and they're definitely a total hip replacement candidate if their symptoms match what we see on x-ray. But I don't want to talk about the hip, I want to talk about what you need to think about when you see a patient who has this spine. So even me as a hip and knee specialist can see that there's a severe scoliotic curve with degenerative disease of the spine. So the things that are important for us as hip surgeons are trying to figure out if the symptoms are coming from the back or the hip, which is not always as easy as it sounds, and some things technically about dealing with a patient, putting a total hip replacement in someone who has a rigid spine. And this is kind of a hot topic in arthroplasty these days because these patients who have a rigid spine, the two issues that can happen are they don't have sit-to-stand mobility of the pelvis and they can be a high dislocation risk. And the second one is if you put a total hip in this patient and then they subsequently have spine surgery, that can put the pelvis in a new orientation and then you can have late dislocations. So those are two things that you need to worry about. And then the third on top of that is deciding what sort of approach you want to do for this patient. This patient with severe disease of the right hip could be done posterior or anterior, but I may lean more towards doing this anteriorly because it will lend extra stability in a patient who I already know is going to be a stability risk.